Assalamu alaikum, sister. Thank you for writing to our live session. As I understand your situation right now, especially during Ramadan, you're going through severe anxiety regarding fear of vomiting. While this is not extremely common, there are, a lot of people who experience this, right? And it's kind of related to a phobia, anxiety, and things like that. So probably initially, you had an anxiety or you had a bad experience with vomiting or seeing someone vomiting or vomiting yourself, which triggered a kind of like an anxiety or a phobia surrounding this, right? I know it's probably very difficult, especially during Ramadan or when you're sick, right? This probably also presents itself very strongly. This kind of is like related to having a panic attack when you think about it. And I'm not really sure if that's what's going on, although you did, you were very concise, with your question and with your situation. But I'm not really sure if you're having signs and symptoms of phobias or panic attacks. From what you have written, though, it does kind of sound that way. So I do suggest that you go to a psychologist or a therapist in your area and, get assessed and participate in therapy, right? Because that's one of the ways that you can overcome this phobia. So the treatment for this, right, is there's many different kinds of treatments. There's exposure therapy where you're slowly exposed to, videos and scenes of people vomiting, right? And I know it sounds really horrific for you, but it's kind of like systematic desensitization, right? So if you see something enough times, it ceases to bother you after a while. And that's, the theory behind exposure therapy. And then there's also cognitive behavioral therapy, which can teach you how to identify negative thoughts that cause, concern and upset feelings, surrounding vomiting. Cognitive behavioral therapy also would involve exposure to the vomiting phobia. It will gradually be exposed, and at that point you usually discuss, the feelings surrounding your experience and what you're thinking about and ways to cope with it on your own. There's also medication that can reduce this phobia. So there's many different things you can do, but right now, sister, since we're in Ramadan and this is, a big concern for you, I would kindly suggest that at this point, you focus on completing Ramadan, right? And you also focus on non-vomiting scenarios, right? So that's kind of like when you're breaking fast, when you're waking up for suhoor. Don't focus on the actual activity of eating, even though you are, because that will lead, maybe to your fears kicking in. Focus on something pleasant. Focus on something good. Because the more we focus on the thing that we fear, the bigger it gets, right? It grows bigger. You may even want to implement like a visual when you're starting to get fearful of vomiting or start thinking about it. You might want to implement a visual of praying or a visual of a big, huge stop sign or a visual of something else that is meaningful to you that will take your mind away from the fear of vomiting and place it somewhere else, right? So the goal is not to give these thoughts and these fears power. And the way we give these thoughts and fears power is, okay, so we see food or we're thinking about it and all of a sudden we're starting to get fearful, we're starting to get anxious. and we're thinking about vomiting and we're spiraling, right? And what that does is it makes the thoughts and the fears bigger. It gives them power. One of the ways to defeat this is to decrease the focus on the thoughts, decrease the power that you're giving it. So again, when you start thinking about vomiting or you start feeling fearful or anxious, focus on something else immediately, right? And a lot of times that helps greatly. Another thing you can do is mindfulness breathing, okay? That keeps us in the present moment and we focus on our breath. And therefore we cannot focus on things, that are in the past or the future, right? And for you, the future is fear of future vomiting, fear of vomiting within the next few minutes or whatever it is. So if you're breathing deep, doing your deep breathing, you're reoxygenating your body, you're focusing on your breath and not the thing that you're fearing, and you're calming yourself down. Mindfulness breathing calms us down, okay? And during mindfulness breathing, if the thoughts come into your mind, right, it's kind of like that old-fashioned saying, let it go in one ear and out the other, right? So you'll acknowledge it, you'll recognize it, and you'll be like, okay, I'm thinking about this, but you just let it flow. You let it flow out. You don't give it any further thought. You don't think about it. You just acknowledge it and let it flow out and focus on your breath. So sister, please, inshallah, try these tips to get, through the rest of Ramadan. Know that if this is a phobia and an anxiety, it is treatable. Okay. So I kindly suggest that after Ramadan, inshallah, you connect with a therapist in your area, get assessed, and begin treatment for this possible phobia. We wish you the best.